This is your ploy to encourage trying to play around with your injection frequency, thus resulting in a better quality of life. You can trust the medical textbooks, but at the end of the day, I think the more frequent you inject, the less side effects that occur. What is up, everyone? It's Russo. I hope everyone is doing well. ASMR spritz noises of intelligent iron. Gotta buy it to smell it. All right, today I'm going to be ranting about testosterone replacement therapy clinics in Europe, or TRT doctors, regular doctors in Europe, failure to understand serum concentration levels of synthetic androgens upon administration to their clients via, I've gotten a couple DMs. My IG is currently down for everyone wondering, and it went down hours after I released that cure video, so shocker there. But I've gone DMs over the years that some of my followers in Europe will go to a TRT doctor and they will give them one shot of indecanate a month. And that's what they're doing. So the doctor will pin them in the office and then they got to come back to get their next pin. It's crazy. I know it's not like the United States, but I wanted to make fun of this because this is actually licensed medical professionals doing this, and they will start their patient off with this much indecanate. By the end of the month when they need their next shot, their levels are all the way down there, thus in my opinion resulting in a worse quality of life before starting and having a roller coaster of synthetic androgens going on in the body, thus dysregulating all the feedback loops, dysregulating the neurochemistry around AR firing, overall just having this yo-yo that's incredibly long and horrible, and this goes on period after period after period. Then the patient who's not understanding of how serum concentration levels work, hates TRT, gets off TRT, it fucked them up, goes on the internet, and that was from a medical environment of a licensed professional reading the book that they don't get sued on and doing this protocol. This has been in my DM box a couple times. Okay, I want to go into injection frequency. A lot of issues around testosterone and why your mood is rapidly going up and down is from serum concentration levels of androgens. So I have the Peducation series, which I'll have Andrew throw up there, where I talk about different esters of steroids. The ester meaning how long it lasts in the body, how long it maintains serum concentrations. You can go even more nerd and look up the blood levels when they peak, when they rise, when they fall, of any single ester. There's tons of data out there to form your own plan, but I'm saying this even in a cypionate or enanthate level setup. You know, a standard test cycle of cypionate or enanthate, whether that be HRT, which is like 140 to 165 a week, whether that be TRT, which is, in my opinion, 200, whether it be bodybuilder TRT, which is 250, or whether it be a blast of 500. Most people will split that up Monday, Thursday. And from my personal experience, I like doing 3 injections per week, and I notice much more stable mood than doing Monday, Thursday. Come Thursday, I am fiending for my shot because my mood was up here. It's dipping down towards Wednesday, Thursday gets there, boom. Mood's dipping, everything's dipping, boom. When it comes to actual bodybuilding, if I were to blast, I've talked about this before, and I'm going to throw up an excerpt of what Sustanon is from my Peducation series. This blend is 4 different esters, 30 milligrams of testosterone propionate, 60 milligrams of testosterone phenylpropionate, 60 milligrams of testosterone isocarpate. I can't even pronounce that, nor have I ever heard of that ester outside of Sustanon. Finishing off with 100 milligrams of testosterone decanate. So you have 30 milligrams of propionate, which is ultra fast acting, which is going to peak within the day. And then you have 2 medium esters, which are around 2 to 4 day half-life. And then you have decanate, which is above 7-day half-life. So you have this crazy blend of multiple peaking esters giving you multiple different serum concentrations throughout the day, essentially, making this a very unique blend of testosterone. So you can go watch the full video on Sustanon. Sustanon is, in my opinion, the best injectable administration of testosterone for bodybuilder type results. Problem is, is if you read online, you can get away with injecting it every 3 days is what most people do with Sustanon. I'm here to tell you that I did every 3 days and got tremendous amounts of estrogen, acne, DHT related side effects because the injection frequency was too long for that. If you condense all those esters into everyday pins, my levels stay the most stable. I get the most strength gains. With the multiple peaking esters that are constantly being replaced in the body that are peaking at different times during the day, I also get tremendous fullness that's constant. My neurochem stays right on track, and it's overall the best way to use testosterone. And you could go crazy with the dosages, right? We have big ass bodybuilders following. I encourage them to go from Test D to daily Sustanon injections if you're doing a gram, and to see how much better you can feel with Sustanon being active every day versus these massive indecanate shots that are still peaking, lowering, throwing everything off. Stability is key with injecting Sustanon, but I wanted to really highlight how important it is to nail injection frequency. I'm all nitpicking and like saying that, you know, I did Sustanon every 3 days. It's getting gyno when I was younger, getting acne. I bumped it up to every 2 days. The gyno was less prominent and the acne was starting to go away. I injected every day. My acne pretty much went away. And I added in a little bit of AI, got the gyno under control. And then I was stable. I was fine. My mood didn't dip all over the place. If you're a guy who pins, misses a shot, pins, misses a shot, not only are you fucking up the serum concentration levels, you're fucking up the feedback loops of estrogen and prolactin, which are regulating other things. Injection frequency is extremely important, and people just think, oh yeah, I'll do a shot Monday, Thursday. This is your ploy to encourage trying to play around with your injection frequency, thus resulting in a better quality of life. You can trust the medical textbooks, but at the end of the day, I think the more frequent you inject, the less side effects that occur. The more your gear goes, you know, you can use less gear and get more results with a higher injection frequency. And if you're afraid to pin a 27 gauge insulin syringe that some 12-year-old girl is pinning for her insulin every single day as a type 1 diabetic, I don't know what to tell you. Just continue to be a fucking SARM goblin and shut the fuck up. Because with slim pins being able to pin oil, you have less scar tissue than fucking jabbing a 24-inch in you twice a week versus doing a slim pin every day, increasing your injection frequency to a point where everything's crazy stable, and it's much easier to mitigate side effects when your body's not yo-yoing every week. And I use the extreme example of these doctors in Europe which will give undecanate. Undecanate is something that a bodybuilder would use if they're going on vacation. If they're going on vacation and don't want to bring their steroids, you pin 2-3 grams of undecanate before you leave, and by the time you get home, your blood levels are still above 1,000 and you can go back to your normal steroids. People are doing undecanate under medical guidance from a medical professional with 1 shot a month. That's insane. That highlights the extreme dangers of not understanding injection frequency, serum concentration levels, and their lives are probably worse. Their quality of life is probably worse having this roller coaster of feeling great right after the shot, the body freaking out as the androgens dissipate. Maybe it's trying to recover its own HPTA. The estrogen and prolactin feedback loops are off. The neurochem loops, depending on ER and AR firing, are off. And then the doctor adds in another shot and starts the bullshit over again. This can be minimized into normal bodybuilder cycles of testosterone and enthate. 2 shots a week might not be enough. You might like 4 shots a week, and you might split it into a little slim pin instead of busting out a big 24 gauge. I don't see the point of busting out 24 gauges unless you're doing over 3 cc's of gear a week constantly. Then bust out the big boy syringes. But I can say, if you do higher injection frequency, I guarantee your gear goes a much longer way. You have less side effects, you have better brain chemistry health, and you have more fullness during the day. Your AR constantly at the same level. When I pin Sustanon every single day, 500 Sustanon a week, split into daily injections from a 27 gauge slim pin, I like that better than doing a gram of Test D a week, pinning twice a week. I will see you guys in my next video.